So this is a really important question that we're going to be discussing at one of the educational sessions during the GU track of the ESMO Asia meeting. We'll be discussing the initial treatment of patients with hormone-sensitive metastatic prostate cancer. And unfortunately, many patients in our part of the world do present with metastatic disease at diagnosis. And that's in contrast to populations in the US or Europe, where perhaps there's more screening and awareness, and we're catching prostate cancers at earlier and more curable stages. So this is a very, very relevant question to our patients in the Asian populations, and particularly in the Middle East where I work, where a lot of men sadly present with metastatic hormone-sensitive disease. Now, luckily, we have many additional treatments in combination with the androgen deprivation therapy that we can use to prolong survival. We have the option of using oral androgen receptor signaling inhibitors. So we have several that we can use that have had shown overall survival and are approved in this setting. We can use the option of Abiraterone plus prednisolone, which now has generic formulations, and the price has come down significantly. We can use medications such as Enzalutamide and Apalutamide, which also are slightly different types of hormonal medication, different toxicity profiles in different patients, but again have very, very effective results in improving survival in combination with androgen deprivation therapy. And more recently, we've also got the option of triplet therapy for certain patients, which involves giving a short course of chemotherapy plus either oral Abiraterone to continue or a medication called Darolutamide. So we have multiple options for our patients. It's really important that we are assessing all of their clinical and access issues when we are choosing therapies. But one of the most important things is translating these data into our clinical practice. And even in the US and in the UK, we know that not all men who could benefit from these treatments are getting them. So this is where our educational work comes in. This is when our multidisciplinary work is so important, engaging with our urology colleagues, making sure that men who need these treatments can benefit from them.